Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Streptococcal Agalactiae causes early onset disease and late onset disease. Early onset disease was done, but the late onset disease. In late onset disease, Streptococcal Agalactiae in late onset disease occurs in infants between the age group of 1 week to 3 months after birth, and this late onset disease is mainly acquired by contact with a mother might have streptococcus agalactiae, and he might she and through the mother the child might get the infection, or from nursery personnel, or that is nurses, and all of them might have, any one of them might have streptococcal agalactiae, which can give the infection to the infant, or more commonly than during delivery, because during delivery early onset disease is most common. If the child gets infected during delivery, then the child presents with disease within 48 hours itself, or mostly within 1 week. If the child presents after 1 week to 3 months, then always it is by hospital personnels only. Then, in this, the meningitis is most common feature of late onset infection, whereas in early onset infection, pneumonia is most common infection followed by meningitis. Whereas in late onset infection, meningitis is the most common manifestation for late onset infection. And these late onset infections are also associated with a strain of capsular type 3.
thank you and thank you for watching.